If you'd like your body to be in optimum state and recover from pain, you might need to consider recovering with red light therapy. In today's episode with Graham Harper, he's the innovator and visionary behind Lumaflex, a pioneering company at the forefront of red light therapy innovation. The first question I have is, how can entrepreneurs recover with red light therapy? Heal Podcast with Lily Patrascu shares longevity and anti-aging techniques to stay young forever, increase energy, overcome addiction, and live your longest, best life ever. Shared by world's most innovative, alternative, and traditional health thought leaders, healers, and doctors. Discover quantum healing strategies to heal your mind, body, and soul.
Yeah, I mean, I think when you get really into red light therapy and what it can do for all kinds of human conditions, it's something that I don't think is talked about enough, that it can just be for overall well-being, for corporate wellness, helping you wake up in the morning, helping you not be so dependent on coffee, being less anxious, getting better sleep. And I think that's kind of a conversation that will be coming more and more in the coming years as red light therapy becomes more known and more widely used. But for now, where light therapy in general kind of confines itself, or where it's the most prominent, is in beauty. And then next to that is more medical, for wound healing and recovery from serious injuries. And I'm very much passionate about bringing it into the sports recovery and optimization space, right? For fitness enthusiasts, for pro athletes, and even those, those weekend warriors, that 87-year-old lady that still wants to smash golf balls and be competitive, that would be my grandma. So I'm kind of encouraging red light therapy to be used more in that space. But for someone who's an entrepreneur, right, it's an aggressive kind of title, right? It's all on you, full responsibility. There's no days off. Entrepreneurs don't get days off, right? So optimizing yourself, your well-being, your mental state, getting good sleep, definitely as a tool just to optimize you and to be more efficient in what you're trying to do, whatever your career is, or whatever you're trying to build. I would highly encourage all the entrepreneurs to get onto red light therapy.
But tell us more about how it works exactly and why does it work?
Red light therapy, whenever you hear anything to do with light therapy, it's cellular health. It's addressing an issue at a cellular level, because it's not anything fancy. It's not like something, just, cocked it up in a laboratory or anything. It's from the sun. Red and infrared light is available to us throughout the day, all the time, especially if you're in sunny areas. Optimal time to get it is at sunrise and sunset. That's when it's basically just pure red and infrared light. But a lot of us don't have access to, beach houses in Thailand or for Miami for me. But that is where you can get a very good amount of red and infrared light if you're consistent with every day. So what with the light, what you have to understand about the light is able to penetrate your skin and give energy to the mitochondria. Your body's made up of cells, billions of cells, and inside the cell is the engine, the driver, right? We all know this from school class, in our younger years. So giving energy to the mitochondria allows the cell to perform better, to do its job, right? To do what it's supposed to do. So it's like, think of your body like your cell phone. As the cell phone is used, it starts to drain battery, right? And as the battery is drained, it gets a bit slow. Maybe some apps you can't use, like you can't do gaming on it because it's very, very slow. So you need to charge. You need to put that charge in. And that is how that's the analogy I would like people to see of what light therapy is. It's giving your body energy, it's giving your cells energy. And then from there, you can get outcomes. Well, even to backtrack a little bit, there's the mechanisms that occur in your body with this increased cellular energy, right? Is increased ATP, enhanced blood circulation, and anti-inflammation. These mechanisms, they provide us with a range of benefits, like anything from, hair growth to collagen production. That's the whole beauty space. Is light therapy is, producing collagen in your skin. That's where you get those LED masks that my wife, wears every night. It's kind of, those TikTok videos that you see with, the husband showing, what's she wearing? But that's all collagen production. It's making, people be able to lose their wrinkles, blemishes, pimples, all of that. That's all producing collagen. It's making you young. And then from there, it's anti-inflammation benefits, and allows you to recover from pain, right? And even in some cases that I've had the privilege to witness to and been, and why I'm so passionate about red light therapy is it can actually, you can find relief and healing from chronic pain that's been around for 20 years in some cases. And actually that is how I myself got into red light therapy. Is I was suffering from some very serious injuries coming from a competitive background. I was very good at rugby, but not good enough to avoid getting seriously injured. And then from there, I went to amateur boxing, which again, I was good, but I just wasn't conditioned for impact sports pretty much. And it resulted in a tumor in my head, which I had to have surgically removed. But all those injuries, I was able to recover because my wife introduced me to red light therapy. And the device that she had me use, it was really cumbersome. It was something that it was difficult to use. It was even very ugly. It was a lamp, that with a very large bulb. And I just did it to appease her. I thought, okay, I want to make my wife happy, make sure that she feels like she's helping me out in my broken, injured state. So I would, put my injury, I'd sort of aim at the pain wherever I was feeling it, and I would try to get as close as I could to the light. But then the bulb would get very hot, so I'd have to move away, and I'd play this sort of dancing game. But every night she told me to do it for 20 minutes. And I remember this most serious pain that I had was my left knee from rugby. It was something I dealt with for years, and I wasn't able to sit down because it would get so inflamed. It would start to ache, pain. It meant like taking flights or even being in an Uber for a long enough time would hurt. But I remember that was kind of my big aha moment, because after a week, I didn't have the pain in my knee. And after another week, I just stopped using it. I was like, bada bing, bada bang, bada boom, I'm done, I'm finished. But what it really triggered in my head was like, wow, what is this? What is light therapy? And I went down the rabbit hole, and that's how, sort of long story short, it's like we're talking about almost 6 years. That's when Lumaflex came about, where I wanted to create something that was portable, easier to use, durable, something this one's fully waterproof, and you can use it on the go. You can throw it in your gym bag, right? So, think about the amazing impact that light therapy can have on the world when, you're taking someone that has suffered from chronic pain for 20 years and you're introducing them something that is natural. It's 100% natural. It's light. It's from the sun, but it's in a higher dose in a device, and they're finding healing, right? I mean, for me, it was mind blowing. And a lot of people that are that have dealt with chronic pain, or at least have family members that have suffered from pain, and gone into, pain medication, all of this. It's something that's it's hard to not see this as my calling in life, right? Like, this is the thing that I need to do. And I need to push for until the day I die, right? So, yeah, it's been amazing.
Thank you. I'm so glad you talked about that, because, for example, I've been ill for 10 years with sore throat and cough and migraine. Okay. And I'm kind of miraculously managed to, heal my migraine, but my sore throat, I hadn't. Okay. Until I went to Spain, and then I was there for 3 months, and probably because of the sun, I was 90% recovered. So I imagine that from what you said, that Lumaflex is basically, like, it has like a similar effect where instead of, for example, if you live in London where it's gray a lot of the time and you don't get the opportunity to be in the sun so much, and you don't get the benefits of the sun, you can have almost like a portable thing that as I can see from what you've shown, it seems very light, and it's very easy to carry it around. And it's not very, it's not very bulky. So that helps quite a lot in terms of, portability. And I remember years ago, I was also, just to finish the story, whilst in Spain, I was like 90% recovered. Okay. But I remember years ago, that I started using this machine, which you might know, and it was like initially like a small hair dryer kind of thing, and it had some light therapy, but I don't think it was red light therapy. I'm not sure what type it was, and I did find that, for example, if you had like a tooth infection, or if you had an inflammation, or you had pain in a certain area, it would work in order to reduce that pain or to reduce that inflammation. And what I prefer versus that one that I had was that your one seems to be a lot more portable and a lot kind of like it has like a bigger space as well that you can use it on, and a bigger, and then I bought a larger one, which was maybe like 4 times the size of a hair dryer. Okay, so that one was even bulkier, and I still prefer your one if it has like similar benefits. And I do find that it
That's right.
Okay, it works.
Yes.
So it works in terms of like improving the skin texture. So, for example, one concern that I've always had is open pores. Okay, so when you do this kind of therapy with light, it can help you to reduce the pores. So then it gives you that rejuvenated aspect. So I love that. Or about as well, like for example, I've suffered with acne, and I've found that light therapy can help with that. And I think you mentioned as well that it can be used for beauty, right? So tell us more about the studies and the thousands of people that have already used this kind of technology.
Yeah, it's actually been around for like a very long time. It's sort of been classed as like pseudoscience. And when you're in, the actual medical term is photobiomodulation. So when you're in photobiomodulation, when you're in this industry and you're meeting doctors and scientists and other people that are, in product development, they're, launching all kinds of different products, something specific for medical, something more for spa, for beauty, something for some large, very, very large devices. It's very enlightening. Like I've met doctors, I've met scientists, some scientists I've met who've devoted their entire life to just studying light therapy, to running trials and to being that's all they care about, is just getting this out to the world. And where it kind of exploded was it's not actually that long ago. It's like within the last 10 years, we had, a lot of well-recognized public figures that are like, like someone like Andrew Huberman, right? Joe Rogan, Gary Brecka, Ben Greenfield. They're almost like social media celebrities, right? But they're involved in that health space, and they start to highlight it. Look, I'm using this. Look at this clinical research. Look at this, and they sort of made it popular, made it sort of more mainstream. And I guess, for lack of a better word, like made it more trendy. So thanks to them, they kind of grew the overall awareness. But if anyone who's listening, something I'd like to offer your listeners is I have a photobiomodulation scientist on my team. He runs all my education, and we have an educational course that I'm very, very proud of. It's actually like, I would say that is our first product, more so than the Lumaflex product line. Is I always push the education first, and I encourage people to get on board with that, and then let the product follow. But anybody who's listening, if you message me on Instagram at John Graham Fitness, just say, hi, hey, I'd like to get involved with your course. You send me your email, and I'll give you free access to the back end. And in that that's where we're going over all the studies. That's where there's even a global database of every clinical study to do with light therapy. It's so extensive, but in our company, we call that our favorite link on the internet. And it's so big. It's wonderful if you love to read studies, and you wake up in the morning, you have your coffee, and instead of flipping through, social media, if you're down to read a clinical study, you do Control F, you type in a condition like, arthritis, and then you can pick a study and you can actually read something about how amazing light therapy is being used in all these conditions, right? Some of them are very, very serious conditions too, that it's being tested, and more is developing. An interesting space in light therapy now that everyone should pay attention to is the brain. That's very, very interesting. Eye health and the brain. That's kind of something I want to keep my ear on the ground and see. I believe right now, it's encouraged that you can spend at least 3 minutes looking at infrared light a day to improve your eye health. Eye doctors use it for eye diseases. For brain, we're looking at like Parkinson's, dementia, all these neurodegenerative diseases that people have in their brain, where there's actually studies coming out about people being healed and like their symptoms reversing. Very exciting, something I'm very, very passionate and excited about to see how that goes. But yeah, with Lumaflex itself, I wanted to create sort of an all-in-one device, not a device just for the shoulder or just for the face or just for the knee, a device that's flexible, it's moldable, so it can go to any muscle or joint. And this is FDA cleared also for skin rejuvenation, for hair growth, and for pain management. So we actually do quite well in beauty awards, even though I'm not really in the beauty space. And I love how beauty is making light therapy so well known. It's not a beauty device, but women like it because they say, if I have a mask, I can use it on my face. Whereas with this, I can put it on my face and I can also use it, it's liquid silicone, so you can wash it. It's fully waterproof. So I can even give it to my dog. My dog has a condition. I can share it with my family and it's easy to clean it and I can put it in different areas. But the rule, something I always want to make clear about devices, to give a bit of education about a wellness device versus a treatment device, is we require with this device that it touches skin. So you can't put it obviously over clothing, and we don't encourage to have it away from you because we feel like light reflects. And I'm not saying that you don't get benefit from a device that has distance, but it's hard to guarantee a certain amount of output, like that is written in the specs. Like if you have your manual and you have your certain specs that you provide, like you have your detailed specs, I want to guarantee that into the customer's body. So how do I do that? I say, okay, I'm going to work with 10 minutes. So I put a 10-minute timer on the battery. And then I said, in order for me to get the most amount of treatment to get a pain management, result, let's just put it on the skin. Let's just encourage touching skin. And then they're getting those results into their body. And then you can start to measure, if you have a condition, 2 treatments a day, do it every day for a week. Let's do another assessment. It's something that can be like in a protocol. But that's something I always wanted to note is, a device in terms of treatment to help you with an ailment, with pain, especially if you've got like a deep chronic pain, like bone, you need infrared and you need to touch your skin because the further you are away, the light's bouncing off. It's hard to say, yes, you're getting benefit 100%. So if you touch the skin, you can say pretty confidently, you're getting the full treatment.
Thank you. So it can be used for chronic pain management on a long-term basis. So let's say you're suffering from like a chronic disease, you can use this as an additional thing to alongside whatever you're already using to see how it goes. Yeah. And like, let's say if you have like right now I have inflated eyes, and I know it's probably not as obvious because of the lights that I have on me. But let's say if I was to use that, and let's say if that was caused by, at the moment, I don't know what it's caused by, but let's say it's caused by kidneys, it would still potentially help because it would help the mitochondria, so the cellular health, and that would help me basically, that would help my body to heal itself. Is that how it works? Yeah.
Yeah. I mean, I would encourage, obviously, I very much need to always remind myself to when I give advice, seek a medical professional, ask your doctor for advice. But, yes, light therapy is working on a cellular level. So yes, of course, check with your doctor, but most doctors, light therapy, they would always say like, it's not, there's no negative side effects. And we're addressing the issue on a cellular level. So anything that the cell is required to do, or that it needs to be optimized or recovered or healed, anything up from there, we can get benefit. It's kind of once you start to understand that, it's just simply like plugging in the phone. Then it's you start to understand like, wow, there are many conditions you can use it for, and the result, the feedback is always different to each person. So there are some people who after 10 minutes, like one session of Lumaflex, 20 years, I had a rugby shoulder, it's working and swinging my arms around. He's calling his wife. There's that one story is quite funny. I was in New York for a conference, and I had Peter there, who was my my educational director, and he's filming a video. He's doing a project about light therapy. So he wants to get footage and reactions about light therapy. And he's doing it for like all the brands in the world for light therapy. So he filmed this video of this guy, using the Lumaflex on his shoulder and having this, he was crazy. He was so impressed and amazed that he had this response. But someone else might take a week, some people 2 weeks, some people a month. It's different to each person. The level of inflammation, them as a human, how healthy they are. And it can even be just to how hydrated they are. Like water is such a key metric when it comes to your response of light therapy. You need to be very well hydrated. You need to make sure you don't have chronic dehydration. You obviously need sleep. If you can imagine, like James has, he lost his job, so he's very stressed. Then you have Rebecca, who's got cancer, different levels of inflammation, right? And they need different dosages based on their age and what they're trying to deal with. For Jessica, she may need, for Rebecca, she might need like a full body of 20 minutes, full body, and maybe twice a day. Whereas with James, he's probably, one session of 10 minutes, and he's probably okay for, one session every 2 days. It's different. Each person is completely different. And it's all down to someone being, number one, very willing to try, willing to invest the time, and then tracking it. Like, what's your pain rating from 1 to 10? What is it tomorrow? Because usually your response is the next morning if you've done your treatment the night before. And then measuring and seeing how it goes along. And then, of course, yes, consulting with a medical professional and always getting someone involved. But make sure you get a doctor who's very bullish about red light therapy, not someone who's trying to push drugs to you, right?
Thank you. Now, when I was using light therapy, I noticed immediate effects in terms of, for example, the beauty in the skin and the reduction of pores and the reduction of acne and even reduction of toothache. When I was a lot younger, whatever reason, I was eating a lot of sweets and I had sometimes like tooth infection like 20 something years ago. And I remember that it was very good for even like reducing that inflammation. And then sometimes I didn't even need to take antibiotic, which was something I would have had to do. So I'm wondering, what would you say to non-believers of this particular technology? Because the reason I ask you this is because, for example, like my parents, they have a lot of pain. And I know that, it's been very hard for me to convince them to look at alternative technology, but I would so love for them to use some of this to kind of get rid of it.
Yeah, it's a problem, I think, not just me, but everyone that's in photobiomodulation, even if they're a scientist or doctor, but certainly everyone who has a product, especially the founders of products that are dealing with brain conditions, right? They got a really big mountain to climb to try to, introduce it. And it is like understandable. It's still relatively new, and it just depends on the communities that you're in. But I think where we're at right now, like with light therapy, is we're kind of past that, it's just pseudoscience. It is mainstream. Like there's 10,000 studies and counting on light therapy. So it's very, very well researched. Pretty much every product, like my product with FDA class 2, pretty much everyone's product is FDA approved. It's all cleared, FDA listed. So it's kind of past that, does it work? It's all down to whether or not the individual wants to try it, and most importantly, wants to invest the time. I always give an analogy of because I was in fitness for my whole life, and I used to own lots of gyms, and I used to train trainers. I had like a very big system doing this, but I would have these clients, and you tell them, I want to lose weight. And I was always like, consistency is key. You always, you chirp that same old, that same old thing, like nothing happens without consistency. And it's the exact same thing for light therapy. Like no one expects to be a millionaire overnight. No one expects to lose weight overnight. And certainly you can't expect to be miraculously healed overnight with light therapy. More often than not, it's something you have to invest your time in. But, what I can say is once you have a consistent use of red light therapy on a daily basis, when you do get injured or when you do have inflammation of any kind, your recovery, your response is far faster. It's like hyper sped up. And if you think about it, back in, Bible times and ancient times, we would wake up when the sun rised, right? This would start our circadian rhythm. This is where we would get all our boosting of our cells, right? We'd have our body's natural SPF boosted and everything. And then it would protect us throughout the day. And then we would sleep when the sun went down. And this became like our cycle, right? So if you think about it, that's in our biology. That's our design, is to wake up at sunrise and get our infrared light. So our consistency, our exposure to infrared light, which is also available to us throughout the day, it's just other UV light is also available at that time. So it's not pure red and infrared light. You can kind of start to understand that because everyone, well, in my space, everyone knows that we as a human race are like close to 95% deficient in light therapy compared to how we were before. So if you really understand like cellular energy, this is what it's doing for the body. And yes, it was part of our cycle. We would wake up, we would get it a lot. It probably makes sense that this is what we're designed to do, just like with water. If you would use the analogy also of water, of chronic hydration, and it's easily fixed by drinking more water. I would say light as a human is before, water. It's like that is a basic need that we have forgotten that we should be having every day. Light, clean water, healthy food, regular exercise, deep sleep. This is something that we all know we should have. And I think light, on a consistent basis is something we should be having all the time. But yeah, it's hard when you speak to people, like you said, that are non-believers. It's sometimes they just they don't get it. Oh, I don't understand it. Forget it. So I'm just gonna, say some people you can't help, I guess. Right.
So recently, anti-aging, longevity, and also having a good quality of life has become incredibly important to me because I'm 43 now. Okay. So now I'm kind of starting to think, okay, I want to have a good quality of life. And the reason why that has become so important was because over the summer, I stayed a few months with a relative and she had very low mobility and it was very difficult for her to do certain things because she was in a lot of pain. So I wonder about the impact of Lumaflex red light therapy on anti-aging and longevity, and also on mobility. Because, for example, if you have like knee pain, you are going to be physically impaired. You're going to find it very difficult to do certain things. And if you are I don't know, if your overall health is not very good because you have Alzheimer's or all the Parkinson's or the other conditions, then again you're going to have the kind of quality of life that's not even worth living, So
that's right.
Tell us more about how often should we use this red light therapy in order to see an impact, and for how long? I know that every single condition will have a different impact, but how long would you say that it takes to kind of see a little bit of a difference? I mean, you did say earlier, Eva, you can even notice a difference within a day. But how long would you say to notice a considerable difference in terms of, let's say, people that have had, let's say, pain for 20 years in their knee or arthritis or, something that is like a really terrible pain that has impaired their mobility for 20 years. How long has it been for a lot of them to, I don't know, fully recover, but at least to feel a considerable difference to the point of feeling like they're a new person, that they really have improved their quality of life?
Yeah, that's a very, very good question. Like I've answered this question a lot because it is the question it deserves to, like, that everyone wants to ask that, right? It's well deserved. So referencing like your typical photobiomodulation doctor, someone who practices, red light therapy in their practice, they have conditions, they will usually give a prescription of no less than a month. No less than a month. In my personal experience, like in my, and then also running the brand, growing the product, doing user testing, going to conferences and all of this, I would say with the 10 years, what I would say is like the average for me, what I've experienced, what I've seen is 2 weeks. Is 2 weeks where I've seen like people go from 0 to hero. 20 years, oh my God, John, no. It's a miracle I met you. And that goes from like those cases where, like I said, with the guy with the shoulder, or someone messages me like, I don't know what this is. This is amazing. You have that group. And then also with people that, oh, I feel slightly better. Oh yeah, I'm going to stay consistent. I've kind of averaged it all out. And it's about 2 weeks, I would say, is where I sit. For me personally, I see the sweet spot.
Thank you. Do you find that that people tend to like get a benefit for their condition, as in like every person that you have given this to, that you have sold this to, do they all get a benefit from using this? Like, did they all say, oh, I have noticed a slight difference, or I have noticed a slight or a massive improvement? Do they all get that?
Yeah, something that like I'm not actually very proud to say, but pretty much everyone that purchases from us, as in a direct to consumer, they know about light therapy. They're already sold on light therapy. They just want the hot portable one. So they already know the overall wellness benefits. The reason why I say I'm not so happy about that is because I want to be selling to people that know nothing about light therapy. They're the ones that I'm trying to bring into the family. But of course, that's to do with branding, with messaging, with content, with partnerships. And it's kind of commercializing it so I can speak to that audience that's never known it before. But when you have someone who knows about red light therapy, they see it the same way I see it, as a vitamin. So they see improve overall mental health, improve sleep. They're not depressed. They don't have anxiety. They see faster recovery, and they're very familiar with this benefit. And they are like me. It's like they don't go a day without it. Like when I wake up in the morning, my eyes are barely awake. I'll reach over to where I have the Lumaflex plugged in charging, and I'll put it on my forehead. I'll get light to my brain the first thing in the morning for 10 minutes. Then I'll put it on my heart. Then I'll put it on my spine. I can always sneak it into my clothing. Then I'll put it on my gut, for my gut health. And those are areas that if you're in light therapy, you get those areas regardless of like, if there's no pain, you get those areas just for your overall well-being, just to support your body's overall health. But then for pain conditions, that's when, with a device like this, you can aim at the pain. So, I mean, most of the people that use it, they do know about red light therapy. They've had a device before. They have a large device, but they want a portable one. So the testimonials I get are usually on the pain side, where someone says, oh, this has really helped me with my pain. But it's all like those same customers are already feeling a very, a wellness benefit, an overall well-being benefit, because they use it like a vitamin. It's like they wake up and, you have your multivitamin. That's kind of something that's sort of encouraged when you wake up in the morning to get your supplements in. I see light as that multivitamin. The sun, with all the different rays of light, the different nanometers, that's our multivitamin. So that's where I would, if someone's never tried light therapy and you're in an environment that's like 30 degrees away from the equator, you likely don't have much access to sunlight. Andrew Huberman is always, recommending get outside first thing in the morning, walk outside. And he really talks a lot about the benefits of getting that first 10 minutes outside. But definitely this is like bringing the sun into your house. You can wake up with this and again, put it on those areas and you'll feel overall benefit to your well-being, to you as a human. You're like, wow, why am I not so anxious all the time? Why am I not so depressed? Why do I have like that, spring in my step? That's something that I think a lot of people that are, maybe have that, real tough 9-to-5 sort of jobs, maybe don't live these, vibrant, dancing on the beach, watching the sunrise kind of lifestyles. I really think that they will see a huge benefit to their overall, mental health just by having light therapy every day.
Thank you. I think the target is no longer, to live until you're 100. I think the target is to have, that mobility, the quality of life, to feel really great, to be in a good mood, to have like that perfect health and to live as long as possible. So I wonder about the health of the eyes. So how safe is it to use it on the eyes? Because I would imagine if you're looking at a direct light, it could like impact your eyesight in a negative way. But I'm assuming you're going to keep your eyes closed and you're going to just keep the this device on top of it in order to optimize your eyesight. And my other question was, for example, for preventing neurodegenerative diseases. Let's say you don't have any sign of it. Why does that actually work, the Lumaflex, to prevent or to optimize these kind of neurodegenerative conditions?
Yeah, I mean, these are very exciting questions. So because I have to put on the cap of Lumaflex, right? So I have to make sure that I have liability, right? So in my manual, I always say, when you do not look at the LEDs, close your eyes. If you're going to, put it on your eyes, close your eyes. But I would encourage everyone, taking my Lumaflex hat off, to go and explore the benefits that light therapy can do for improved eyesight and for overall eye health. And I believe that is something that I think the latest research is showing, that you can look at the LEDs, whatever device you're using, for 3 minutes a day to improve your eyesight. But again, that's something I would encourage people to research on their own. But yeah, for us at Lumaflex, in our manual, we have to be careful. We say close your eyes when you're using it on your eyes. Now for the brain. Okay, so for the brain, the nanometers that I have in the Body Pro and in the Essential. So I have two devices. One is for retail, and one is for it's like the Pro use. It has a spare battery. This one's fully waterproof. It's also app connected. This one, the battery's fixed, and it's not fully waterproof. You can just clean this side, right? Now, the nanometers that I have in these devices is 630, 850. So I have a red nanometer, which goes about 1 inch into the body, and then an infrared nanometer that goes about 4 inches into the body. Now, when you're talking about, brain disease, Alzheimer's, Parkinson's, all these dementia, these sorts of conditions of the brain, you need a deeper nanometer. You need a much deeper nanometer. And that there are about 4 companies in the world, I believe. There's about 4, at least 4 that I know of, that I love and respect. All the founders of those companies, like, they're my besties, because I just love what they're doing. They're heavily researched companies, and their devices are, fitting to the brain, or like, it's like a band. And these devices, the nanometers go deeper into the brain. There's a lady, Sarah Turner. I would highly encourage everyone to research her, but her device has frequencies of light and a much larger spectrum of light. The deeper nanometer being 1070, right? So you can imagine this one is 850, and then her nanometer is 1070. And she's also using frequencies to address different, brain conditions. So that is where that research that they're doing, and those devices, when you deep dive into the devices that they're making, it's all very precise, and they operate in a very it's a medical device, but they're not FDA approved, because to get FDA approval on that, it's like 4 million to get an FDA approval, right? And when you get this, when a company shoots to get FDA approved and they invest that money, you have like a little small window to promote your product, to get to grow the brand, because once that technology is FDA cleared, you can use it as a predicate. Other brands will use that FDA to get their product FDA cleared. So it's kind of all of them as a collective of brain scientists, using photobiomodulation. They're wonderful people. And Sarah Turner is definitely one you can research. There's a couple other brands I know. I know one gentleman, he's German, and he comes to the near this production office. He gets his product made in the same manufacturing area as I do, and we talk a lot about it. But his device is like a helmet. It's like a big helmet, and it's they're absolutely amazing people. We just talk about clinical research, about what they're doing, and it's all heavily researched, these devices. So for me, when I'm doing when I'm holding this to my head, I wouldn't expect I'm getting, to be 100% honest, I'm not expecting to get any kind of benefit on those, brain disease side. It's more just to help me wake up, to be alert, right? To optimize my, cognitive energy and focus. If somebody had a brain condition, I would say you need to find look at one of these companies, and you need to find a deep nanometer that goes in, deep into the brain. And that area, like I said before, it's such an exciting area where, you reach, I think, in developed countries, you reach 80 years old, you flip a coin, 50% chance you'll have dementia. It's like an insane statistic, and, obviously my parents, they're reaching that age now, and it's concerning. And, what's going to happen then? Like, how are they going to function, be happy? How are they going to live out the rest of their lives? They're going to be stuck in some home or have some caretaker. So to have an option and have these scientists and these doctors heavily research this and devote their lives to it, it's very exciting. I really feel so blessed to be able to, have relationships with them, to know their products, because this is something that I'm going to be introducing, obviously, to my parents, right? When they start reaching that age. And it's really exciting. Sometimes I get very emotional about how, just what's on the edge and what people are sacrificing in their personal lives and their personal finance and their workload, their relationships, just to be able to devote their time to study, and grow the awareness of light therapy.
Thank you. Tell us where entrepreneurs can find Lumaflex.
So Lumaflex, lumaflex.com, Luma meaning light, flex as in flexible, right? So that was the key thing. Touch skin, mold to joints and muscles. But like I said, I'd love to give our education. This is actually the book, our education book, but it's, it goes through the science of light therapy, and it's packaged for someone who's has no idea, from zero to hero. That's the goal with this education. And I would love to give, anyone who messages me on Instagram at John Graham Fitness, I'd love to give you access. Obviously, my goal is to grow the student base in our academy and have people talk about it, make it that conversation at brunch, like, did you know, we should try to, yeah, I would like it to be talked about more, I hear people with different conditions, my grandma this or my auntie this, and I have to go drive to help my auntie, and nobody's talking about it enough, right? We're still about, I'd say 3 to 5 years away from it being fully mainstream, where, every home has a light therapy device in it. We're not quite there. It's coming.
Follow me for more interviews with world's most innovative health change makers to live your healthiest life ever.